Hi, this is Cynthia Jester with United States University FMP program. This is the Neuro Assessment video, and I'm going to start the room scan. Ceiling, floor, and my patient. Okay, do you give permission for this video to be uploaded for educational purposes to YouTube?
Yes, I do.
Okay, I will start the examination. Can you tell me your name?
Jane Milton,
What is your birthday?
11/16/80,
And what is today?
October 16, 2024.
And what and why are you here?
For you to check me out
For the video?
for the video.
Okay. And can you tell me who's the last three presidents?
Biden, Obama,
And Trump.
and Trump.
Okay. And can you also tell me if you were walking down the street and you found the envelope that was fully addressed with a stamp on it, what would you do with it?
Put it in the mail.
Okay. And tell me what did you have for breakfast?
McDonald's.
Okay. And do you remember how you celebrated your last birthday?
Yes.
How did you celebrate it?
I went out for dinner.
Okay. All right. So I assessed my patient's mentality, her speech. She's A&O times 4. Her speech is clear. Her affect is calm. She is cooperative. Her memory, long-term and short-term memory, is intact. I'm going to move on to cranial nerve number 1, which is the olfactory. Oh, and I washed my hands before I started the procedure. I'm going to test her olfactory cranial nerve number 1 with smell. Okay, can you close one nostril? Tell me, what do you smell?
Chocolate.
Okay. Do the other nose.
Oranges.
Okay, and she was correct with discerning which sense she was smelling. And now I'm going to do cranial nerve number 2, which is the optic nerve, and I'm going to check it with the Snellen chart. We are 6 feet. Hold your hand out. We're 6 feet from each other, and so I'm going to ask you to cover one eye and read the best line.
FPH.
Okay, now change eyes.
FPH.
Okay, now with both eyes.
FPH.
Okay, so the patient has 20/20 vision. She's got 20/20 in the right and in the left. Okay, I will now test for constriction and concentric. So I'm going to use my pen light and I'm going to check her pupils to see what the pupillary response is. I'm going to shine the light in her left eye. Okay, open your eye. Okay, her pupil, it constricted from 4 down to a 3. I'm going to check the right eye. Same, the pupil constricted from 4 down to a 3. And now I'm going to check for concentric constriction. So I'm going to shine the light in her left eye while I observe the right pupil to see the response. Open your eyes. Okay, and I see the constriction of her pupil. I'm going to check the right eye and look in the left eye. Okay, and she has concentric constriction. Okay, I'm going to also check the movement of oculomotor 3, 4, and 6. Oculomotor, trochlear, and abducent. Okay, and I'm looking for any nystagmus, and if she has some, I will count the beat. Okay, follow, only with your eyes, follow the pen. Okay, and she was able to follow with her eyes. Oculomotor is up and down. Trochlear is medial and lateral, and abducens is also, it abducts. Okay, I am going to check cranial nerve number 5. I'm going to ask you to close your mouth, clench your teeth. Okay, all right, open your mouth. Okay, all right, that's good. Okay, I'm going to check for, I'm going to check the sensory on her face. I'm going to check for, to see if she can discern the difference. Okay, I'm going to check her forehead, the cheeks, and the chin. Tell me what you feel. Soft or hard?
Soft.
Soft or hard?
Soft. 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 Soft.
Okay. All right. Tell me what you feel.
Hard. 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 Hard.
Okay. Okay, I want you to open your mouth. No, just open your mouth. Okay, close it. I want you to frown. Frown. Okay, raise your eyebrows. Now smile. Okay, so that was the facial nerve. So I did cranial nerve, trigeminal nerve for sensory and for motor. I did cranial nerve number 7 for the facial movement. She's able to frown, raise her eyebrows. So now I am going to check cranial nerve 9, 10, and 12. Okay, so I want you to, now you can open your mouth and say ah. Stick your tongue out, move it from side to side. Okay, puff your jaws out. Okay, stick your tongue. Do that one. Okay, so, and she has a gag reflex. So the vagus nerve, cranial nerve 10, is the nerve that's responsible for the gag and the swallowing. And the glossal and hypoglossal is controlling the tongue and the way that the palate is raising, and her tongue is midline. And so it's normal findings for those cranial nerves. Now, I need to check cranial nerve number 8, which is acoustic. And I'm going to check that with the tuning fork. I'm going to put it on the forehead. Tell me, where do you hear it?
In both ears.
Yes, okay. All right, so sound is being conducted through the bone to both ears equally.
Yes.
Okay, and then I'm going to put it on the maculus. Tell me when you, do you hear it?
Yes.
Tell me when you stop hearing it.
It stopped.
Okay, tell me, do you hear it?
Yes.
Okay, all right, let me check your other ear. Okay, do you hear it?
Yes.
Tell me when you stop.
It stopped.
Okay, do you hear it?
Yes.
Okay, so sound was able to be transmitted through the bone to both ears, and then when the sound stopped conducting through the bone, I put it to the ear, and she was still able to hear it. So air conduction is greater than bone conduction. me see. Oh, I need to check her eyes, and then that will be it for the eye exam. I'm going to take the ophthalmoscope. I'm going to hold it for safety. I'm going to brace her head with my hand so that, if I had a sudden movement, it wouldn't go in and injure her. And I'm going to look at the eye structures. Okay. All right. Okay, I'm looking at the macula, the fovea, the blood vessels, the retina, and there's no AV nicking in the blood vessels, no cotton wool spots. I see the disc is round, is sharp, and the margins are 3:1. I will check her opposite eye, the left eye. I will come in, I will look for the fovea, I'm looking at the macula, I'm looking at the blood vessels, the retina. There's no AV nicking, there's no cotton wool spots. The disc is round, the margins are sharp, and the disc is 3:1. Okay, I will now move on and have her to walk. Can you stand up? And I need you just to walk normal, not far, because we have to stay in the camera. Okay, no, walk this way. Okay, her gait is normal. It's regular. She's not, I'm not finished. She's not wobbly or anything. And so I need you to walk heel to toe, the tandem. Okay. All right, she's able to do heel to toe. Now walk on your toes. Okay, and walk on your heels. Okay, all right. And hold your arms out. Close your eyes. Okay. All right, and there's no pronator drift. Okay, have a seat. Okay, I'm going to check your muscle strength. Okay, do your arms up like this. And don't let me pull. Okay, that's good. Okay, do your arms like this. Don't let me push them down. Don't let me push them up. Okay, so I say her strength is 5 out of 5. Open your fingers. Don't let me close them. Okay, she's got good, strong finger strength. Squeeze my hand. She's got a strong hand grip. I'm going to do the reflex, deep tendon reflex. Okay, I'm going to test her the brachial and the triceps. Okay, that's good. Okay. Okay. All right, normal reflexes. Okay, put your legs together. Lift them up. No, raise. Raise your legs up. Okay, don't let me push down. Okay, she's got good strength. Open your legs. Okay, and pull them together so she can abduct, adduct. She can bring her legs in, bring her legs. Do you have any pain with that?
No.
Okay. All right, I got, let's see. Okay, I want you to close your eyes, and I'm gonna put something in your hand. Open up. Okay. What did I put in your hand?
A quarter.
Okay, that is correct. And let me have your other hand. What did I put in your hand?
A dime.
Okay, very good. Okay, she was able to, with the 2-point discrimination, she was able to identify what I placed in her hand. I'm going to check vibration. Here, put your legs out. Okay, tell me if you feel it.
Yes.
Okay. Tell me if you feel it.
Yes.
Okay, so her sensory is intact down through her extremities. I'm going to check your foot for a Babinski. Okay, let me trip the other one. Okay. The reflex is negative. She does not have a Babinski reflex. And I need to check the patella, deep tendon. Move your leg. Okay, the other one. Move your leg. Okay. And then the Achilles tendon. Okay. Okay. All right. And I think that I have covered everything. And that's it for the neuro assessment. Thank you.